So good afternoon. I'm Jonathan Fung from the Department of Physics and Astronomy. And on behalf of the organizing committee, it's my pleasure to welcome all of you to What Matters to Me and Why at the UCI Medical Center. First, some housekeeping announcements. So this talk is being filmed, as you might have noticed. By entering the room, you have consented to being filmed. So if you would not like to appear on the video, please move to the back. There's a few seats in the back, and then you won't show up. At the end of the talk, we'll have a question and answer session. So please wait for the microphone if you want to ask a question, because that way your audio will appear on the video. When you came in, you were handed a questionnaire, I believe. We take feedback, particularly suggestions for future speakers, very, very seriously. And so please do spend a few minutes at the end filling that out and particularly thinking about what future speakers you might want to hear from. And last, please help us by bringing your lunch out of the room when you leave, because we'd like to leave the room as we found it when we are all done. Okay, so now on to the talk. As staff, faculty, residents, physicians, fellows, and students, we spend much of our time here dealing with exams, lectures, clinical practice, and other topics, doing the things that are required to keep the university and the medical center and our careers running. What matters to me and why is a chance to take a few minutes each month to stop and take a bit of a break from our usually frenetic activities. For the second time in 2019, we have the opportunity to hear from someone who shapes UCI through her daily activities, who will give a short, informal talk, followed by ample time for questions and discussion. There is no prescribed topic for these talks. Speakers are simply asked to answer the question, what matters to you and why, authentically and frankly, and take that wherever it goes. This series provides a forum for speakers to talk about values, beliefs, and motivations, and perhaps to share how these have been shaped by their personal experiences, including both the very highs and the very lows encountered along the way. The hope is to strengthen bonds between the faculty, students, and staff who discover, teach, and heal here, and celebrate both the diversity of this community and also the commonalities that bind us together. So because this series does attract people from across several departments and fields all over UCI, it's our tradition to actually start by giving you a minute to introduce yourself to someone you don't know, perhaps sitting right next to you. And then after that's done, and it's only 60 seconds, okay? After that's done, I will invite Dean Dr. Michael Stamos to come up and introduce today's speaker.
Good afternoon, everybody. So I want to say, first of all, for a surgeon, 60 seconds is like a lifetime. Thank God there's a timer up here. I would have cut you off after 20 seconds. You know, that's been a minute, hasn't it? So welcome, everybody. I want to really thanks Professor Fung again. There you are, right in front of me. For number one, for founding this program at UCI, and also for once again traveling to Orange to be with us today. We really appreciate it. The lunch that we're providing is hardly any return on your investment, but thank you anyway. Hopefully you.
The one we have on campus.
It's all relative, isn't it? That's right. That's great. So we kicked off the Medical Center series in January with Dr. Leigh Buckland, who's here today to hear her colleague, and we wanted to thank her again and tell you that you can find a video of her presentation, her talk, on the website if you missed it. And I think all of the talks on the main campus are also archived on the website, correct? Yeah. Together with CEO Rick Janata, who I think could not be here today, it's our hope to continue this program on a quarterly basis for those who work and study here in the Orange campus. I had to, now that I spend more and more time on the Irvine campus, I had to overcome my comment about this being the main campus. They all think that's the main campus, so it's all a matter of perspective, right? So the chancellor got tired of hearing me say the main campus, meaning Orange. So. But it's all good now. But it's important that we hear a diverse perspective of voices for this series, and the opportunity is open to any and all. And we would encourage strongly nominations, either self-nominations, which are great, or nominations of a friend or colleague who you think really has something special to share with all of us. It's now my great pleasure to welcome Dr. Cynthia Hawk to join us. I'll give a brief introduction for her first. She's a clinical professor and chair of the Department of Family Medicine, and she's a champion for primary health care, for health equity, and for preparing health professionals, medical students, residents, and fellows to serve disadvantaged patients and communities. Prior to joining UCI just a little over a year ago, she served as professor of family medicine and population health sciences at the University of Wisconsin. While at UW, she served as founding director of the Global Health Institute, the training in urban medicine and public health program called Triumph. She designed and led educational programs, and she worked in rural Belleville and central Milwaukee, seeing patients regularly, not just talking from the ivory tower, but actually in the community providing care, especially in a rural environment. She's worked in many areas overseas, including rural Uganda, urban Karachi. She helped establish the first family medicine residency programs in Pakistan, in Uganda, and in Ethiopia. And she served as a consultant to the World Health Organization. She's received numerous teaching and research awards, including 2 Fulbright Fellowships and the AAMC National Award for Humanism in Medicine. She received her MD degree from Indiana University and completed her residency at the University of Wisconsin, but now is happy to call California her home, especially this winter, which I think is still continuing in some areas of the country. She was also, I believe, my first chair recruit as dean, and so I'm particularly proud of her and what she's doing here, and we're just so happy to support her, and I'm anxious to hear what she has to say about what matters to her and why. I've gotten to know her quite well over the last year plus, but I think I'll probably learn some new things today. So please join me in welcoming her to the podium.
Thank you, Dean Stamos. I am so fortunate to be here, and thank you for the honor of being your first recruit, and really for you, Dr. Fong, for asking this question today. I've never had such an open-ended question and podium to speak to people who actually might want to listen to what I have to say, so watch out. I can tell some stories. I can talk for a while, but I'm going to try to keep it limited so there's plenty of time for questions. I was talking to my daughter about this talk coming up, and she said, "Oh, Mom, you have to wear your button." And I'm like, "Button?" So this button says, the best things in life aren't things, right? And I found this button, I can't even remember where I got it, many years ago. And I keep it in my car, just over the dash, because it's just a constant reminder that there are all those things that are so important to us that are not material, but relationships, a sense of purpose and meaning, an opportunity to actually work towards dreams and make the world better. So for me, these are the things that enable us as physicians, as health professionals, to work towards the dream that everyone, everywhere, should have the opportunity to thrive. Not just some people, but everyone should have that chance. And indeed, I've been able to do that over the course of my career, at least make small contributions. So where did this come from? How did I come about? Well, my father came from India and my mother from Indiana. These are my family, and so I grew up in and between 2 very different worlds. From the time I was a small child, we went back and forth to Pakistan and rural Indiana, the Louisville area. And I have to say that I was blessed with an abundance of life and love and support. Both of my families on both sides placed a very high value on the importance of education. My grandfather, Cecil Irwin, he was a high school principal. And so, of course, I had to start learning to type when I was like 5 years old. And so he made sure that as his little scholar, I did well in school. There was no question about that. And of course, even on my Indian side, my family came from a part of India that placed a very high premium on education for everyone, including girls. So that was lucky for me. My father was raised up under the British Empire. He was a captain in the Indian Army at the time of the partition between India and Pakistan, and then became an officer in the Pakistani Army, being Muslim. his family moved over to the Pakistani side, and he was sent to Fort Knox, Kentucky, where he met my mother, who happened to be there for a summer job. And so there I am. Yes, yes, right. Okay, that's how I came about. I have to say that my mother and father, they were so loving and encouraging, and they provided the safety and security of a home where I was encouraged to follow my dreams, and where I never had to worry whether I would be safe or cared for. And I know that these advantages that I brought from my family really fueled my ability to thrive and to go forward along in school. When I was 7 years old, my mother and I read the diary of Anne Frank. And my mother was one who asked a lot of questions. And she really encouraged me to ask questions as well. And when we read the diary, we were actually getting ready to go to Pakistan, and we were able to stop by in Amsterdam and actually visit Anne Frank's home. And in my 7-year-old mind, I think I absorbed that deep sense of what a lovely young woman she was, and how her life was cut so tragically short, and how there were some people in the world that are very cruel and hurt others, and there are other people who are very brave and courageous, and they stand up to help others, and that there was a chance to make a choice, that I could be the one to stand up for others. We lived in Pakistan, where I was often seeing a lot of children in the community that were poor, that they didn't have obviously enough food to eat or proper clothes to wear, and even they looked sick, and they weren't in a stable situation like I was. And I asked my mother, why don't those children have what they need? I have what I need, and why don't they have what they need? And her answer to me was, there but for the grace of God goes you. That was her answer. And so it left me with this question of, okay, how did I get so lucky? And a lot of other people were not so lucky, and what could I do? What could I do about that? So I finished high school. I met my now late husband, Bob. We got married when I was still undergraduate. And Bob was from rural Kentucky. He was one of 15 children. And of course, he was really ready to start a family, which is what we did. So we had 4 wonderful children together. And becoming a mother and having a family was just the most incredible joy of my life. And of course, you fall in love with your children. There's nothing more important. But at the same time, I'm wondering, is there more that I could do? I was majoring in biology as an undergraduate, thinking of grad school, this and that, and I thought, gosh, I think I can make a bigger difference as a physician. I'll apply to medical school. And my husband, Bob, and I talked about this, and I said, I really think I need to work in areas where the needs are greatest. Would you be with me? Can you support that decision? And absolutely every step of the way, Bob was there to help me with the raising of the children, with our travels that I'll say a bit more about. But we have 4 lovely children, and of course, they are what means the world to me. And this is my eldest son when he graduated from Harvard Law School, and he's here in Los Angeles, so I get to see him on a regular basis now that I'm living in the area. So at any rate, having a family was really a life changer, but at the same time, I thought, could I do more? Maybe I could become a physician. And I went to my college counselor, and I got an interview to go to Indiana University Medical School, and she said, well, first up, you have to get a suit. You can't dress like that in my blue jeans and flannel. You have to get a suit because this is the most important interview of your life. She also said, for sure, don't tell them that you're married and don't tell them you have a child, because if they find out, you'll never get in. At this point, 10% of students were women, at Indiana University. And they said, you won't be admitted. So the day came for my interview, and I went in, and it turns out the person interviewing me is a psychiatrist. Now, at this point, I think psychiatrists have superpowers. You know, they can read your mind. And so, of course, after the formalities of the interview, he's like, "So, what do you like to do with your free time?" And I'm like, what do I do? Do I tell the truth or not? And I was sure he could read my mind. So I went ahead and I spilled the beans. I said, well, actually, I'm married. I have a 1-year-old son. I like to spend time with my family. And he's like, that's marvelous. And I got into medical school, thank goodness, right? Yeah. So as I was in medical school, you know, the children came, and we're moving along the path, and it was challenging for me being in medical school. I really felt oftentimes like I didn't belong. I think we hear about the imposter syndrome, that you don't belong. Well, I had one female faculty when I was in medical school, and many of the men were actually overtly hostile to women and would come out and say, you don't belong here. You're actually taking up the spot that a man could be. You'll never work as a doctor. You're just wasting our time. So that kind of rubbed it in that, you know, maybe I didn't belong there, and maybe it was just a matter of time before they found out I really wasn't smart enough to be a doctor. But somehow or another, partly because I was worried I'd never pay my loans off if I dropped out, I just kept going. And yeah, so, and in the back of my mind, I was troubled by the fact that not everyone in the world had a chance. This was at the time, this was in the 70s, late 70s, 80s, when Martin Luther King was still very much in our mind. Of all forms of inequality, injustice in healthcare is the most inhumane. And at the time also, we were in the shadow of the Declaration of Alma Ata at the WHO, World Health Organization, held a conference in which they said that health is a fundamental human right and that everyone in the world should have access to primary health care. And in fact, that's the role of governments to ensure this access. And there was a campaign underway, Health for All, by the year 2000. And so we thought if we just worked hard enough, we could make sure everybody got access to health care by the year 2000. And so it was during my residency that I started to think about the opportunity to work abroad where the needs were greatest. What could I do, and where could I go, and how could I make a contribution? And so my family and I, this is my husband and our 3 children at the time, and some dear friends that we've stayed in touch with. I was able to get a job towards the end of my residency as my pediatric rotation, actually, abroad. I went for 3 months to Uganda, where I was to be the medical director of a rural health center. I felt that this was a place we could go because the needs were great. Civil war had just ended. 1 out of 3 children was dying before the age of 5. So it was very high child mortality. Peace had come to the area, but most of the doctors had either been killed or run away. And at the time when I went to Uganda, there were 13 million people, 200 doctors in the whole country. And the area that I was assigned to be medical director was caring for a population of about 500,000 people. And I was the only doctor in that area. There were medical assistants, nurses, midwives, and community health outreach workers. My job was to train village health workers to intervene in the major causes of child death. So that was my main job. But at the same time, there were so many patients coming to be seen. Our health center would see about 500 or so patients a day. And so the staff of the center, they would save their most difficult patients for me to consult on. But I learned the value of working with a team, because this team of health workers that had stayed on at their posts without pay through the war taught me so much. The administrator of the clinic sat me down the first day I came, and he said, I know you're a doctor and you're trained to see patients, but you could see patients here 24 hours a day, 7 days a week, and you won't make much of a contribution because our need is so great. Instead, he said, I need you to teach. And if every time you see a patient, you're teaching one of my staff, then you'll leave something important behind. You'll make a contribution that will be long-lasting. And I took that advice to heart, and little did I know that as I was teaching the staff, they were teaching me their culture, their resources, how they handled certain problems. I'd never seen a case of malaria before going to Uganda, and of course, we had people dying every day from malaria. HIV was underway, tuberculosis, so many of those diseases I didn't know how to handle. One of the village health workers that I was training in our course, he came to me one day and said, Doctor, would you see my daughter? She's become ill. And I said, of course, please bring her. I'm happy to see her. We had a small inpatient unit at our facility, and he brought this beautiful girl named Penina for me to see. And she had a very runny nose and a very deep cough, and also a rash. It was the rash of measles. And we were indeed in the midst of a measles outbreak. Many people, many children in particular, were dying of measles because the vaccine cold chain had not been maintained. And I said to James, the health worker, I said, yeah, Penina's very sick. I think she needs to go to the hospital. She had really bad measles pneumonia. And he said, no, doctor, you take care of her. We can't afford to go into the city. It's too far. We have other children. We have to care for the crop. I have to take the village health worker course. I said, no, that's okay. Please take her to the hospital. No, he would not. And so I did the best I could. We treated her with amoxicillin, which was one of the antibiotics we had, one of the few. I would see her every day. And on the third day, there was a knock on the door very early in the morning. And it was James who came to say that, he said, I'm sorry, doctor, I need to tell you some bad news that Penina died. She died in the night. And of course, I was devastated, and James and his family, and immediately felt really guilty that I had let this family down. And I had failed because Penina had died on my watch. She's this beautiful child. I didn't know what to do, but following my instincts with my family, the next day we bought some food, we went to the village where Penina lived, and we paid our respects to the family. And the family welcomed us and greeted us. I was kind of bracing that they were going to be angry, they won't want me to show up. And instead they embraced us and they said, Doctor, we're so happy that you're here, and we know that you did the best that you could do for our daughter. And thank you for being here with us. We're grateful. This was not the reaction that I had expected, but it was one that was so important for me to hear, that the patient, the family, had forgiven me for that terrible loss. But it also got me thinking about the fact that being a good doctor is not good enough. There are so many problems that affect our patients and populations that I needed to do more. I needed to become a change agent and actually work for systemic change. Being a good doctor was part of it, but not all of it. I needed to find out how I could begin to affect health on the population level on a more systemic level. That brought me to my work in Afghanistan, working with women who were dying at very high rates of childbirth, designing curricula there, developing eventually the Center for Global Health at Wisconsin. But let me just say that when I came back and I joined the faculty at Wisconsin, I was told originally, they said, well, you might be interested in international work, but this is a state school, And our interests are in the state of Wisconsin. So if you want to do work abroad, that's on your free time. It's a nice hobby, but that's not what we're interested in, and that's not what we're going to pay you for. So sure enough, I was able to negotiate. Initially, I worked 60%, then I worked 80%, so that I could save some of my time to work abroad. And I used money from moonlighting and from other opportunities to pay for kind of volunteer work abroad for our family. And I did that for about 15 years before finally, when I was working at the WHO as a consultant, the dean sent me a message, the dean of Wisconsin, saying, would you like to lead a committee, an international health advisory committee? And I'm like, well, I don't know, maybe we should talk when I get back. And sure enough, we did talk. And by then I knew that if there was a call for a committee, that meant there was a recognition, there was a problem, there was a need for widespread effort. And eventually this led into the development of the Global Health Institute at Wisconsin, which is now a university-wide program involving hundreds of students per year in dozens of different field sites. But it was really kind of step-by-step learning that I could make a difference, that I could connect the dots, that I could bring people back together. This is actually a picture from the Kasangati Clinic where this is the clinic in Uganda. Before we left, I hired an artist to paint this mural on the wall of a healthy community. Now at the time there were piles of dead bodies. It was the wake of the war. The place was a disaster. There was no window panes. There were holes in the walls. But we painted this image of a beautiful, healthy community. And when I went back many years later, bringing some students from Wisconsin, sure enough, that's how the community looked. And so we could see the effect of time and also people working together to bring about positive change. Now in Uganda, 1 out of 20 children dies before the age of 5. Now that's still very high by our standards, but it's much better than 1 in 3. Right? And so what I found is that as I engaged students, as I taught the lessons that I was learning, the students absorbed this lesson that we can make a difference, we can make a contribution that actually makes things better for everyone. I'm going to bring in this figure just because it's one of my favorite slides, and it's really, as health professionals, as physicians, I mean, we learn about the molecular and the cellular level. We've got a physicist here who's working at the atomic level. In the university, we have the chance to look at all of these different levels of concern. And certainly as physicians, we're usually focused on patients one at a time. At the level of the individual. But we also know that in order for people to be healthy, they need to live in a healthy community. They need to have the right conditions for health. So it's not just medical care, but it's actually creating conditions for health so that populations and communities can thrive, and so that we can bring about changes at the system level, at the policy level, to really make a difference in people's lives. And I have to say that the 2016 election was a bit of a shocker for me, the outcomes. And I realized that while I had the opportunity for many years to work in Wisconsin to bring about programmatic changes, I felt that I was ready to move up to a different level where, as a woman, I could make a broader impact on a health system. And I was so lucky that the job for family medicine chair was open here at UC Irvine. I didn't know about it, where Irvine even was. I Googled it. And I'm like, oh my gosh, it's like an hour from LA. That's where my 2 oldest sons live. Maybe this would work. And it was really the commitment of Dr. Dow and so many others in our department. It was so clear that this was a department in a school that was really committed to improving the health of the community, that there was a mission to serve, and that there was an opportunity perhaps for me to fit in here. I've mentioned that we know health is a byproduct of communities. And so part of this is access to health care for everyone, but we also need to be sure that people can earn a living wage and they have a safe place to live, and food to eat, and all of the other things that go into creating the conditions for healthy communities. One of my favorite poets says, community is the smallest unit of health. It's really hard to think of the health of an individual without thinking of the habitat and the community and the surroundings, the context in which that person lives. So, over the course of my career, I've had the pleasure and privilege of working in 5 continents, the chance to develop and design programs, but I'll say that nothing that I've done has been done by myself alone. It's always been part of a team. It's always been expanding the network and activating others to work together to bring about positive change. This is the first group of Ethiopian family doctors graduating from their program in 2016. This is our Triumph group here in Milwaukee, program in Uganda, and of course these are my grandchildren. And little did I know, this is my oldest granddaughter, Iris. She's half Ugandan, so you never know what happens when you go to visit a new place. Yeah, so right. I'll just conclude by saying I'm so happy to be part of the UCI community in general and part of the Department of Family Medicine, where we have a marvelous team of faculty, residents, staff, working really to promote and activate our core values in improving the health of all of Orange County and beyond. I will also say that our work is not over. Even though I started my career with this idea that we could get health for everyone, we know that that hasn't happened yet. 40 years after Alma Ata, we still have half of the world's population without access to primary health care. This is a huge problem. And in many ways, we could say that I've been a failure because the numbers have only gotten worse over the course of my career. On the other hand, we can say that we as human beings have made tremendous progress. There are more people living better and longer in the world today than ever before in human history. So a lot of progress has been made already, but unfortunately many people are being left behind. And so our job, our opportunity, is to create those options for everyone in the world. So thank you very much.
I love the department tree of your values, by the way. And you want to put that back up, just to leave people a lasting impression of that right there.
Yes. Yeah, and this really emerged from a retreat of our department faculty and staff last year, and we were so happy to have these really rise to the top as our core values of what we try to activate and really implement on a daily basis.
Okay, well, thank you so much for a wonderful talk. Now we have time for Q&A. So again, let me remind you, please wait till the microphone comes to you, and you just raise your hand and we'll come quickly.
Despite you being so humble in what you've accomplished in your career, I have to just say, wow. If more people could be like you, just think about how much better the health and well-being of people would be throughout the global community. You know, instead of just thinking locally in the state of Wisconsin, you thought much broader than that. And it's such a powerful statement of who you are and what your values are. And thank you for sharing that with us.
Well, thank you. And let me just say that my values are really not just mine. I think they're shared by the whole health professional community. and really so many unsung heroes that are on the front lines every day doing this work to make other people's lives better. So I'm so really privileged and fortunate to be in a health professional community where we share these values, and every day the patients in the hospital, in the clinics, in our outreach programs are benefiting from the work that we do. So part of our collective values.
I'd like to second what she said, and I also think you're so awesome, and it's an absolute privilege to get to work with you, and you're just endlessly inspiring and just an amazing human. And to get to train underneath you and people like you and Dr. Dow and Mayorga, and it's pretty awesome. So my question for you is, and I hate to use the word burnout because I feel like it's kind of an overused word these days, but one thing I've seen throughout my entire career and before I went into medicine was the phenomenon of service workers, whether it's people in the nonprofit industry or just any sector of people who are wanting to help and serve, end up burning out or losing that steam and losing that desire because of the endless politics and the endless challenges and all of these obstacles, the lack of funding, and in the end, the need to provide for themselves and for their families. And how did you stay so awesome for so many years? And how did you maintain your drive and your motivation and your passion and your true genuine desire to serve versus either getting thrown off track or sucked into a lot of these politics?
Right. Well, first of all, I understand being overwhelmed and burnt out. My daughter, our third child was born after the end of my intern year, and literally, if my program director had not allowed me to extend my last 2 years of residency into 3, I don't think I would be a doctor today, because it was just so overwhelming, and I felt like I was a bad doctor, a bad mother, and I couldn't do anything. I was so exhausted. So having that flexibility to stretch out my training really made the difference of night and day. And then I was able to kind of begin to work the system, right? I learned that I can work the system to get my needs met so that I can serve other people. So basically, my first job out of residency, I worked 60%. So the other 40%, however, we would go abroad. And those experiences, like I just explained about Uganda, they were so rewarding and enriching that once you get a taste of that and you say, oh my gosh, we can cut child mortality in half, just with these efforts, then you can't stop doing it because it's so fulfilling and enriching. And of course, without my husband, we wouldn't have been able to do any of this, but he was so supportive and encouraging. And so you get these kind of early wins. You notice that you can actually, by your effort, you can make a difference, and it feels really good and rewarding. And then that just fuels you to go on and do more. I do think that the process of medical education and residency training can be very difficult and very, it wears people down to the point where, we have tons of data now to show that medical students tend to come in very altruistic, and they tend to end up very cynical. And why is that? It's because they go through a period of very intense training and deprivation where they're not getting their own personal needs met. And I'm so happy that now we've recognized that doing a good job as health professionals means we also have to take care of ourselves. When I became a mother, starting medical school as a mother, I already had a different kind of mindset because I love so much being a mother. I love my son. And I wasn't willing to give up the rest of my life to be a doctor, which is what I was told I had to do, right? So I fought against that from the very beginning. And I've often said we have to be careful because there's a culture of pathologic workaholism that is in medicine, right? And we have to watch out for that, because there's this sense that, oh, everyone should just work more, faster, faster, faster. There's a point at which we have to say, whoa, time out, that's enough work now. I have to go home and recharge and take care of myself and my family. And so by doing that, by alternating, then it allows you to come back at the next day, right? It's hard at the end of your residency to see that, but that window is going to open for you very soon. Yes, yes, yes.
Thank you for all the, even in your talk, what you have done to advance women in the field and, in these positions. You've been amazing and inspiring. And I just wanted to ask, what do you say to those young girls who have aspirations in male-dominated fields, or they're in they are in an area that is male-dominated, and they're getting those comments that you received when you first joined the faculty, or when you were first in medical school?
I say, you go, girl. Right? Yes. I mean, we just have to keep it up, and we have made progress. It's not the same as when I was a student, but there's still a long ways to go. I will say I'm so proud of my own daughter as a pediatrician. She's on the faculty at Baylor, and very much engaged in global health as well. And I've kind of been able to watch up close her progression through her career, and certainly sexism is not over, it's not finished, but opportunities are opening up, and at some point you just have to step in and see what you can do, right? And don't let the naysayers hold you back.
Quick question, thank you, first of all. So you mentioned your daughter, but are all of your children, do they have that altruistic sense that you do?
Well,
Careful, you're on video.
of course I'm super biased, right? I have to be. My children are really all amazing adults now, and what I so much appreciate is because they were raised under kind of unusual circumstances. They all lived in the developing world at different stages of their childhood. I think they're incredibly open-minded and good travelers and compassionate towards others who are less advantaged, the same way that I think my early travel as a child opened my eyes to the rest of the world and how many people live. And they're all doing things that are in some ways assisting the development of others. So I feel so proud of all of them, and we love spending time together. Yeah.
So I'll join the chorus and say this was a wonderful talk, and you're a wonderful human being. You mentioned that at Wisconsin, you were told that, we're a state institution, our focus, our priorities is our local community. Well, we too are a state institution, I should say, here at UC Irvine. My question for you is, where are our opportunities to have a bigger global impact?
Well, what a great question. And let me just say that I am so pleased that we're able to really practice global health in our own backyard. We have one of the most diverse populations that we're serving of anywhere in the country. And so we have that chance. At Wisconsin, we changed the narrative. What we had to do is bring evidence that actually you can't isolate Wisconsin from the rest of the world. We are interconnected. And not only do we have graduate students coming, we have students traveling. Students were coming and going whether we liked it or not, right? And it was a matter of creating an educational framework and oversight so that we could do that in the most high quality fashion. And we would promote the health of our own students, but also their education. We changed the narrative to a world-class university is engaged with the world. In fact, we can't not be, right, if we're going to be world-class. And so we have so many opportunities right in our own backyard to improve access to health care for those in greatest need. But we also have opportunities to team up across the UC system, University of California, to develop partnerships abroad in which we could bring about long-lasting contributions and partnerships. So I think there are so many opportunities. It's a matter of kind of getting our organizational infrastructure so that we can select some and build programs over time. And those are already underway as we speak. Yes. Well, let me just say by conclusion what a treat this was for me to have a group of people who are willing to just hear me go on. I'm not used to so much talking about myself, but really about the higher purpose that we're all here for, and that is to make the world better, improve the lives of others that we have the opportunity to serve. And we're so lucky, and let's make good use of our good fortune. Yeah, thank you.